Got a nasty bug bite, left dry skin, or a sudden painful pimple, or maybe you are struggling with mouth ulcers, herpes, or even athlete's foot? Today, I will comprehensively cover the best Japanese skin medicines to fix your problems once and for all. Hi everyone, welcome back to my channel. I'm Jun, a licensed pharmacist from Japan. On this channel, I share basic information and introduce healthcare products you can find in Japan. Please make sure to check the disclaimer before we start. Alright, wow, skin medicines come in so many different shapes, don't they? First, let's look at the rubbing types, topical agents. These are divided into two main players, ointments and creams. But do you know how to use them differently? Here is a rule, and this is very important. If the area is wet or weeping, choose ointment. Think of them as the almighty option. Since they are oil-based, they repel water and stay on your skin very well. On the other hand, creams have a smooth texture and are not sticky. They are easy to apply and can be washed off with water. However, there is one important caution: do not use creams on open wounds. Why? Because the ingredients in creams can cause irritation and stinging. Those are the basic differences. Make sure to read the product labels and choose the right type for your symptoms. Besides these, there are also lotions, patches to stick on, and sprays. Now here's a question I get a lot from tourists. Can I buy antibiotics in Japan? The answer is actually no for pills, but yes for ointments. First, you cannot buy oral antibiotics, pills, without a doctor's prescription. This is strictly controlled to prevent drug-resistant bacteria. However, you can buy ointments containing mild antibiotics at drugstores. These are lifesavers for infected scratches or rashes with pus. So remember the rules. Pills, go to a doctor. Ointment, go to a drugstore. Next, let's look at the list of active ingredients. I will explain them one by one. First, steroids, like betamethasone. They strongly extinguish inflammation, redness, and swelling. Use these for severe trouble. Next, non-steroids. This is called NSAIDs, like ibuprofen piconol. They reduce inflammation gently without using steroids, good for acne or face. Next, local anesthetics, like lidocaine. It numbs the skin instantly to stop sharp pain and itching. Next is antihistamine, like diphenhydramine. It blocks the substance that causes itching, histamine, essential for bug bites. Number 5, local stimulants, menthol or Keratinamin. They give a cooling or warming sensation to distract your nerves from the itchy. Number 6, protectants. The shield, like a zinc oxide, it forms a physical barrier to protect the skin. Number 7, tissue repair, like allantoin. It helps repair damaged skin tissues to speed up healing. Number 8 is vasoconstrictors, like a tetrahydrozoline. It shrinks blood vessels to stop bleeding. Number 9, blood circulation, the flow boosters, like a vitamin E and heparinoids. They improve blood flow to fix dry skin from the inside. Check this page. Knowing this ingredient helps you find the perfect cure. Alright, now let's clarify the difference between steroid and non-steroid medicines. Steroids are power fighters. They stop severe inflammation instantly, but do not use them on the infections, bacteria, and virus, because they can suppress immune function. On the other hand, NSAIDs are gentle soothers. They reduce redness softly without steroids, perfect for mild rashes or sensitive areas like the face. Okay, this difference is an important factor when choosing the right product. Now let's take a look at some actual products. For full details, please refer to the published book. First up, let's solve the most common traveler problem: dry skin. Japanese hotel rooms are extremely dry, especially in winter season. If your skin feels rough or itchy, look for this pink box, Hillmild. This is not just a cosmetic lotion, it's a medical treatment for dry skin. The ingredient is heparinoid. Unlike normal creams that just cover the skin, heparinoid promotes blood circulation and repairs the skin structure from the inside. It comes in two types. Choose based on your need. Type 1 cream tube, best for small rough areas like your hands or dry patches on your face. And type 2 lotion bottle. It spreads easily. Use this for wide areas like your legs, arms, or back after a shower. If regular creams are not working for you, upgrade to this medical-grade moisturizer. It fixes the root causes. So that covers Hillmild. For full details, please refer to the published book. Next, the specialist for hardened skin, Keratinamin Core 20% Urea Cream. After working all day in Japan, look at your heels or elbows. Are they hard like a stone? Normal moisturizers are not enough for this. You need Urea. This cream contains a high concentration of 20% Urea. It has a double effect. It turns hard, dead skin cells soft again and pulls moisture inside. So massage it well into your heels, knees, and ankles. But one big warning, do not apply it on open cracks or bleeding fissures. Urea can be irritating on raw skin. Use it on hard skin, not broken skin. And that's wrap up our look at Keratinamin Core 20% Urea Cream. Now let's move to part 2, mild troubles. Imagine you wake up with a pimple on your face right before a photo spot. For this nightmare, grab the silver and blue tube, pair Acne Cream W. This is famous as cure for adult acne. It works in 2 steps. Ibuprofen piconol. It calms the red inflammation without popping the pimple. Step 2. Isopropyl methylphenol. It kills the acne bacteria, but the best feature is the texture. When you apply it, the cream turns transparent, invisible, so you can wear it under makeup or while walking outside, no white spot on your face. Apply it after washing your face to fix pimple quickly. Pair Acne Cream W. Next, look for the Little Nurse logo. You probably know Mentholatum from their famous lip balms, but this is their skin cream, Mentholatum AD Cream M. This is the best choice for warming itchy, like after a hot bath. It is non-steroid, instead it uses the triple attack formula. First, lidocaine, local anesthetic, numbs the skin to stop itchy instantly. Number 2, Keratinamin, warming stimulant, gives the sensation to distract you from the itchy. Third, diphenhydramine, antihistamine, blocks the cause of itchy. Apply an appropriate amount to your dry back or legs. But be careful, do not apply it around your eyes. It is too strong for sensitive areas. So that covers Mentholatum AD Cream M. Now, what if Mentholatum AD is not enough? What if you have severe redness, swelling, or nasty bug bite? It's time to use the power of steroids. We have 2 champions here. First, the king of OTC steroids, Rinderon vs. The name Rinderon is extremely famous in Japan. It is the standard choice. It contains betamethasone. It is the strongest steroid you can buy at drugstores. Use this for severe itchy, rash, eczema, and insect bites. How to use? Apply an appropriate amount to the affected area 1 to several times a day. How much should you apply? Many people apply too little. You need the appropriate amount. Here is a golden rule for ointment or creams. Remember the fingertip unit. Squeeze the medicine from the tip of your index finger to the first joint, like this. This amount, approx 0.5 gram, covers the area equal to 2 adult palms. For lotion, use an amount the size of 1 yen coin. This also covers 2 adult palms. Do not just rub it in. Place it gently on the skin. Important warning, do not apply it widely to your face. And do not use it as a makeup base or after shaving. Also, avoid using it if you have pus or infection. Please the next product instead. And that wraps up our look at Rinderon vs Ointment Cream Lotion. Alright, next. Rinderon vs is great for dry, itchy redness, but what if you scratched too much and the wound is weeping with pus? Use Flucort F instead. This is powerful hybrid ointment. It combines a strong steroid with an antibiotic, Terramycin. The antibiotics kills the bacteria preventing infection, while the steroids stop the painful swelling. It is specifically designed for rashes, eczema, or insect bites that were saturating Herpes. Okay, here is how to use. Apply an appropriate amount to the affected area 1 to several times a day. And remember, avoid using in large amount or for a long period. Be especially careful when using it on the face. Alright, so much for Flucort F ointment. But wait, what if you just have a wound or a boil, pimple with pus, and you don't need to stop itching? You might not want to use steroid. You just want a pure antibiotics to stop infection. For that, here is the new contender, Terramycin A. This ointment contains 2 antibiotics, oxytetracycline and polymyxin B, to cover a broad range of bacteria. And crucially, it contains no steroid. Use this for preventing infection in minor cut or treating boils on your face or body. How to use. Apply an appropriate amount directly or spread it on gauze and cover the wound. Warning, do not use if you have had allergic action to antibiotics. Also avoid using on deep wound or severe burns. Alright, so that covers Terramycin A. Alright, next, let's talk about painful problem inside your mouth ulcers, canker sores. And it hurts when your teeth touch it. For this, Japan has a very unique solutions. Traful Direct A. This is not ointment, it is a patch like this. It contains a steroid to suppress inflammation directly. The best part is you just stick it on the sore. The patch covers the ulcer to protect it from your teeth or spicy food. And don't worry, it is a thin film that dissolves naturally. You don't need to peel it off later. Apply 1 patch once or twice a day. However, do not use it if you suspect an infection like oral herpes or fungus. Also, apply the white side to the sore. Don't get it wrong. This is the explanation of Traful Direct A. Traful is for inside the mouth. Now let's look at the outside. Do you feel a tingling or prickling sensation on your lips? If you suspect a cold sore, herpes, act fast with this Arasena S. It contains an antiviral ingredient called betaravine. It directly attacks herpes virus to stop it from spreading. The key is timing. Use it immediately when you feel the first tingle. If you use it early, it heals much faster. How to use? Apply to the affected area 1 to 4 times a day after meals or before bed. However, there is a strict rule in Japan. This medicine is for recurrence only. You can only buy it if you have been diagnosed with herpes by a doctor in the past. Also, do not use if you are breastfeeding or for children under 6 years old. So that covers Arasena S. Alright, now let's talk about the very common problem athlete's foot's fungal infection. If your feet are itchy and the skin is peeling, you need to kill the fungus. The best choice is Mentholatum Exiv EX, spray, liquid, cream. Why is this popular? Because it works with just 1 application a day. It contains terbinafine. a powerful antifungal ingredient that directly kills the cause of athlete's foot. It also contains lidocaine and Keratinamin to stop the unbearable itch immediately. They have different types. Choose the right weapon. Cream, good for standard area between tools. And liquid, good for targeted use on small areas. Sprays, good for wide application without touching your feet. Also, here are 2 pro tips from the lineup. For nail edges, use the Kiva Care Gel. For rough heels, choose the Deep Tan Cream containing Urea. Here is warning, do not use on dirty feet. Wash and dry your feet before applying. So that covers Mentholatum Exiv EX. Finally, part 4, special care. This is for men who are concerned about thinning hair or hair loss. The champion in Japan is RiUP X5 Charge. It contains 5% minoxidil. This is the only OTC ingredient in Japan recognized to actually grow new hair, not just prevent loss. It activates the hair cells directly. Expect results after 4 months of daily use. How to use? Apply 1 ml to the scalp twice a day. The bottle automatically measures 1 ml for you, so it is very easy. But there is strict rules. This is a class 1 medicine. You usually cannot just take it to the register. You need to speak with a pharmacist during their working hours. Warning, this RiUP is for men only, aged 20 plus. If you are a woman, look for the RiUP region. Okay, so that covers RiUP X5 Charge. And finally, here is the last product for today. Let's look at the special treatment for women's skin. Look at your cheekbones. Do you have symmetrical light brown spots? This might not be a regular sunspot. It is called melasma. It is caused by female hormones, and it's very difficult to care with normal creams. Transino EX, the only effective OTC medicine for this in Japan. It contains tranexamic acid. This ingredient works from the inside to block the inflammation causing the spots. Take 2 tablets twice a day after meals. You need to continue for about 1 month. Limit use to 2 months. But be careful, this is also a class 1 medicine. You must buy it from pharmacists. You cannot just pick it up at the register. Also, strict health warning apply. Do not take if you are receiving diuresis, and consult a doctor if you have blood clot, thrombosis, or are taking other pills containing tranexamic acid. Alright, this is the last product for today, Transino EX. Okay, good job everyone. That was a deep dive into Japanese skincare medicines. As you saw, there is so many products and ingredients. Japanese companies put a lot of creativity and effort into making unique formulas for every needs. The most important thing is knowing which ingredient to use for which symptom, especially when dealing with strong ingredients like antibiotics and steroids. Having this background knowledge is a key to choosing the perfect product for your skin. Use this guide and take care of your skin in Japan. See you in the next episode. お疲れ様でした。